primary care physicians come in from outer practices to work with our hospitalists and care for our patients. We did what the Department of Health asked. We load balanced. We took some patients from some of our partner hospitals in Rochester and other hospitals like Medina to be able to help make sure all hospitals could stay open and functioning. And in doing that, we were able to open up one of our floors and use some of our surge bed capacity and really had some very busy times over a time of year when most people would love to be spending at home with their families. Our nurses, doctors, EVS technicians, lab workers, facility staff, everybody was picking up extra time and extra shifts, sometimes working long hours to be sure that they were here caring for their neighbors. And really, as I walked the floors during that time and saw the extraordinary efforts they were putting in, I was confident that we would see and be able to get through this wave, and we did. As the end of January approached, we saw declining numbers of COVID patients. At one point, with a number of patients close to 50 COVID positive patients in our hospital, during the peak of the surge, we're below 10 now. And so that's been a nice thing to be able to see. And then throw in the middle of that vaccine rollout. And we were able to get a substantial part of our staff who wanted the vaccine that vaccinated. Now almost all the folks who wanted it have had both doses of the vaccine. We have a few that are still going through their second wave, a second dose. But our frontline workers who wanted and needed the vaccine were offered it in a timely manner. And we held clinics, spun them up. At one point in time, we had 4 different clinic work streams going on for vaccines. We had our staff. We were assisting the county and partnering with them for some of our frontline EMS and other what we call 1A classified workers in our community. And then we were rolling out the 65 and older community clinics, and then also doing some clinics for special populations that had difficulty accessing vaccines. So teams of people from across Rochester Regional Health lending a hand. I vividly remember I worked closely with the team doing the Genesee County partner clinics here at the hospital at that first round. And I had nurses and nurse practitioners and midwives coming from the other side of Rochester, driving out here to spend 4, 6, 8 hours to vaccinate people in our community. It just really showed the passion of our health system to stand together, support one another, and make sure we had resources to take care of each of our communities and make that happen. And so now we continue as vaccine is available, and that certainly is the key word. As vaccine is being rolled out, when we're notified that it comes, we give the vaccine to the different community clinics. We'll wrap up the rest of our healthcare workers as more vaccine is available. The ones that continue to, there's reasons why people wouldn't get them at first round, whether they had COVID or whether they had other illnesses, but now they're ready to get them, and we'll make sure we get them their doses as soon as it comes. As you recall, probably you've heard, and I know we've said, the vaccine rollout is highly, highly regulated by the Department of Health, stringent rules that had to be followed. We followed those to the T and made sure that we went forward in the right direction. So I've seen 11 months of a healthcare organization that really was in the middle of making investments in improving healthcare in the community, shift gears to solving a pandemic crisis right here at home. And I saw people from all across, retirees, new nurses, new staff come on board, jump right in, and link hands with our existing skilled professionals to make sure that we could provide the best healthcare possible to the folks around Genesee County.
Great, Dan. Thank you. So just a production note here. The YouTube side of our stream was not live there for a minute or two. For anybody that is viewing this through YouTube on our site, what I'll do is this is recorded on my hard drive at the same time, so I'll just repost from the beginning, to YouTube, and we'll have that on our site. But everybody on Facebook's been getting live the whole time, so we haven't lost anything there. And if there people are watching it on Facebook, if they type in a question that they might have, we'll see if we can answer that as well. to go back kind of to this bit of a surge here earlier this winter, how was hospital capacity? We see the number of hospitalized residents, but they're not all at UMMC for various reasons. People get moved to other parts of the region, and you also have patients coming from elsewhere in the region. How was capacity? Were you ever at a kind of a critical point, or was it pretty? Were you able to handle it all?
Well, we never reached the maximum capacity point. We always had our 25% or better available beds that we could surge into if we needed to. But we were very busy, Howard. I would say, any of the staff members would tell you that, through that period of time, many of our medical units were pretty full, and so we didn't have to surge into a lot of the extra surge beds that we normally or would have if we needed to. We were ready to do that, but we did keep the medical units very full during that time, and there were a few occasions where patients may stay down in the ER for a few extra hours or even overnight till we had to discharge the next day. And again, we did that load balancing just as early on. We accepted some patients from some of the Rochester hospitals. There were points in times where we then asked Rochester to accept some of our patients so that we could free up beds for patients coming in. And again, that's the power of 5 hospitals working together to keep everybody working and going in the same direction. But so to say, I would say we never reached the max. We always kept that buffer in the event there was some other unforeseen instance that might have caused an imminent surge. But we certainly tested our coordinating capabilities and making sure that we could maneuver patients through the healthcare system and keep them safe along the journey.
I remember, when we were first talking, one of the big concerns was capacity for incubators, for ventilators rather, and that. But I'm under the impression that treatment protocols have changed since the early days of the pandemic, and that really was never a critical issue, either locally or anywhere else in the state. Maybe would you be able to address kind of how treatment protocols changed and how UMMC adjusted to new information?
Yeah, a couple things impacted that I think were learned out of the first wave. One, we did acquire more ventilators after the first wave, so we added more to our cache of available equipment. And the other units we added were high flow humidified oxygen, and that had evolved out of the first wave. Initially, you're right, the treatment protocols were, get these patients on ventilators. But then, as the first wave really started to evolve, they found a need that would help avoid some of the ventilators by using high flow oxygen, and you need specific equipment for that. So we were able to acquire some additional units of those prior to the second wave. So we did, and just by sheer numbers, we saw more ventilator patients during the height of this latest surge, but also the total number of inpatients was significantly higher. So proportionally, I think it was probably about the same, but we had the equipment now that we didn't have to worry about, borrowing or getting it shipped in from somewhere else. And again, I think the high flow oxygen played a huge role in it. The use of remdesivir really helped, and those drug treatment protocols, and really it was a very rapid turnaround from what folks learned in the medical community learned in phase 1 to implement in wave 2. You're thinking, realizing that it was only about 8 or 9 months from the beginning when we started doing wave 2, and the medical community responded very well to share information and get the appropriate treatment protocols out to everybody.
There's a lot of kind of amazing things about how quickly our medical community, our scientists have learned and adapted along the way, and then, including the vaccine, which is the next thing I wanted to mention. So during the conference call today with Paul Pettit, he talked about, if I want to get this right, that county health departments primarily handling those first responder type of vaccine priority, and then the priority of the older adults, and that they're looking more to the provider network for people under 65 but who have underlying conditions that make them more vulnerable. So I imagine that comes to your provider network, and I'm wondering if you can address kind of how will people find out their eligibility? How will that? What's the process with the providers to get the vaccine rolled out?
Absolutely, Howard. The selection for patients we've established early on, and it can expand as criteria expands. So even when it was just 65 and older, the selection for patients was an ability for us to go through our electronic medical record system for any Rochester Regional Health Hospital or any affiliate as part of our network. So there are doctors who are not employed by Rochester Regional Health, but are part of what we call our Independent Practice Association, GRIPA. Those type of physicians, their patients are all pooled in a randomizer, and because we have a limited rounds of vaccine, the randomizer then selects patients in a geographic region and helps us contact them to say, we have availability of, let's just say 100 doses on a upcoming date. Would you like an appointment? And if the person answers and chooses for the appointment, then we slot them in. We do all the pre-work to get them there, and then we run them through our clinic to get their vaccination. If they don't answer, they go back into the mix and are able to be called again once we run through the list. And then if they decline, we note that they decline and take them out of the pool until they let us know otherwise. So we felt this was the best way to go about doing this. It was effectively eliminating thousands of calls that would come into doctors' offices, overwhelming them, asking, can I get on the list? Can I get on the list? And also because there's a limited supply of vaccine, it allowed for a fair distribution for getting it to the different categories as they've been defined. So, it's working now. I think as the vaccine volume increases or as the eligibility criteria continues to be modified, we'll obviously keep reassessing it to make sure that's an effective and fair way to get the vaccine out to the folks that need it. But I would say to our community, if you're one of the patients that fit into the groups I just outlined, stand by, wait. We're going to call you as soon as we have vaccine and as soon as your name pops up on the list. I would ask people not to call your doctor's offices and ask when they're going to get the vaccine. That really does tie up the phone lines for people who need to get through for other reasons. So we've got the people on the list, and we're doing everything we can to get them in and get the vaccine. And we have the capability, if enough vaccine came, to run vaccine clinics 7 days a week if we needed to. We've got the staff willing and ready to do it. It's just when you're getting it at 100 doses at a time, you've got to be fair and equitable about how we get it out.
You already anticipated the next question I was going to ask, but it might be worth just kind of reiterating. If you're one of those people that has diabetes, high blood pressure, one of these other risk factors, the message is be patient. Don't overwhelm the providers' offices with phone calls.
Yes, please. We know because our doctors do a great job of collecting those health conditions. We know those conditions, and as the criteria evolves and includes more conditions, we'll add that into our generator and make sure people get a fair shot at the vaccine.
Great. So we've covered the kind of the history up till now. What are your anticipations based on what you're seeing about what epidemiologists are saying, where things are going? What we're seeing with the vaccine, kind of what are your next 2 or 3 months, say, planning to provide healthcare to the community?
Well, our plan and efforts related to COVID are continue to stay the course of reopening everything. So all our primary care practices are reopening. That some of them had kind of curtailed to more televisits during the peak of it. Our surgery is reopened for full surgery as of this week and overnight stays. So our plan is to continue to push forward on those reopening and keeping those going and continue to keep people safe. Visitation reopened this week as well, but it's still limited, and it will be for a while, I believe. We don't want to rush out too quickly and do things that could put the community at risk. I think there are still unknowns evolving about this virus that we want to make sure we're watching closely. But we know that everybody wants to get back to their degree of normalcy, and what that will look like. So our plan is to continue to support that effort. work very closely with Paul Pettit and the County Health Department and supporting any needs related to getting vaccinations out there. And then really get back to the business of improving healthcare in our community. What didn't slow down during COVID was all of our planning related to enhancing our facilities, to doing the upgrade work to some of our campuses, and recruiting new specialists to our community. And so there's a lot of efforts going on there, and none of that has slowed down. That's been ongoing. It's amazing the interviews you can do over the Skype and Zoom and all those other things. And so we've kept it going. And so the goal is, as COVID becomes more of a, I think the epidemiologists and a lot of scientists are saying, is more of the norm, then we want to continue to get facilities open to care for patients. Facilities like the renovation work to our radiology and our future ICU expansion that'll be breaking ground here in the next few months. The work around the Healthy Living Campus that we've talked about for many years continues to go forward as far as our planning and work around that. And then our destination campus that we announced that we're starting to plan for and build. All of those projects are vital to the aftermath of COVID and to making sure healthcare in our community and the surrounding communities stays vibrant and is accessible to everyone.
Great, Dan. Appreciate it. We've covered a lot of ground. Anything else you want to discuss today or add?
I just ask our community if you can help us pass the word around, continue to stay safe, wear the masks, continue that social distancing, go at the reopening of all things with a healthy sense of caution, and we'll get through this together as a community. And the last thing I want to say is thank you. Our community has stepped up beyond any imaginable idea what they could have done for us. They've done all throughout the last year. The support has been incredible, businesses and individuals alike. And I can't thank everyone enough for taking care of our healthcare workers so they could take care of you. So it's great to see our community do that. And thank you, everyone, for that.
Great, Dan. I appreciate your time. It was very informative. So thank you.
Thanks, Howard. It's good talking to you as always.
Great. Thank you. So this is Howard Owens with another live stream interview. We're signing off for the day, and everybody be safe and healthy out there.